Hi, this is Chris Blake. Dan Hall and I have volunteered in Uganda at the Uganda Rural Fund for approaching 3 years now. We've worked with orphans. We've worked with child-led households where the kids stay on and live after their parents have died of AIDS, usually. We've worked at Hope Academy, where education is brought to AIDS orphans in hopes of bettering their lives. And we've worked with the women of Uganda, a remarkable bunch. But we've noticed something about their lives that we wanted to talk about here. And that is that it's hard for them to get health care. This relates to poverty and distance, basically. But in general, the women of Uganda and the Chetame area face a crisis in health care. They face malaria. 6,000 of them die in childbirth every year. 7.5% of women are HIV positive, and that rate's increasing. And syphilis is endemic. 8 out of 10 children are born with syphilis. And 200 of those children don't make it to infancy. 60% of those kids are born at home. The problem again revolves around poverty and the fact that the Chetame area has one main road and hundreds of miles of dirt roads and paths, which are hours and hours of walk to the Chetame village, where there is a government health clinic, which in and of itself is understaffed and woefully ill-equipped. So women are usually referred to Masaka, to the hospital, for complications and difficulties. The problem with this hospital in Masaka for these women is that it's 30 miles down this road with speeding buses full of tourists on their way to animal preserves in the south. And the women can hardly afford to go to Masaka, and certainly not repeatedly. So on serious matters of health, they give up.
Okay. Disc.
Yeah.
All right. Does she know what causes malaria?
No.
Okay. The mosquitoes? Yeah.
She has said no.
She doesn't know?
Yes.
All right. Does she know what causes diarrhea for the baby?
She doesn't know.
She doesn't know. Okay. If she needs to go to the hospital, how does she get there?
So they walk and they walk and they walk, trying to get health care. And very often, again, they give up and go home. This doesn't always have very good results for them. The Uganda Rural Fund has taken the decision to purchase a van to support the transport of rural women to needed health care in this area, to solve the question of transport and health and life and death for these women. I was there recently, and the stories of why this is the thing to do are really quite something.
Had transportation for them, would they go more likely?
Yeah, they will, because like there are women who have like, you have to go and give birth, but then sometimes there is no transport.
Right.
And then sometimes it is very far, because like our health centers, especially in rural places, a person, like most women, why they actually don't go for the antenatal and the giving birth in the health center is it is very far. So
Yes.
you can't, if you are in labor, you cannot walk 5 hours to go
Yes.
to a health center. Now, like if a woman who's staying in Luamanyonyi, up there,
Yes.
it is past Chawagon. You don't take, and around here there is only one health center, that one in Chetame. You don't expect her to walk from that place and come to this place. And like, it depends. If your husband is well off, and well off I mean if he has a bicycle, then it might be easy. But then if he has nothing, then yesterday I was coming back here, and then a few women were going to Paris, and one of their friends died. No, the baby died, because there was no transport to take her to a health center, and by the time they reached there, it was too late. Even when they tried, because they did a cesarean section, but then it was too late, so they were going to bury the baby yesterday because the baby passed away.
So she's saying many of them die in the villages, and those who can come here in the in the clinics here in the Chetume, because there are not enough materials to use, so most of them will die.
Bwe nali olubuto nentuusa okugenda okuzaala nembulwa obujjanjabi, kati nagenda okutuusibwa mu ddwaliro olw'okulwa mu kyalo omwana nga amaze okufiira munda.
But when she was pregnant, she got a problem with accessing transport mainly. But by the time she got the transport and she reached the hospital, the baby had already died inside her.
So sorry.
That have never healed from that time up to today, and she has never been able to get another child after that.
Does she have other children?
She has one daughter.
Good.
The time when she went into labor, it was late in the night, and they tried to get transport, but then the first person told them you have to buy a full jerrycan of fuel, and then the other person told them you have to pay 60,000 shillings. So she wasn't able to go to the hospital to give birth, and she gave birth from here. So now she's like, if she was able to access transport, then she would have given birth from the hospital, because now she doesn't know whether the child that she gave birth to when she was positive is positive or negative.
Has the child been tested? Find out.
Yeah.
Whereas if we've been able to give her transport, she'd know right
she
away.
would immediately, they would do a PCR test.
Yes,
because
right.
right now there is early infant diagnosis of HIV/AIDS, so they would have checked immediately.
Is she worried?
Mukati omwana okubanga kale tewamukebezanga tomanyi kikweraliikiriza.
Ye era kineeraliikiriza kubanga ayagala mmanyi nti omwana wange mulamu.
Because some of them take long to reach the centers, and they live on their way. In case of a complication, babies die on the way. Others reach when it is late and the labor is complicated and babies die out of delay. So some mothers die in the process. Sometimes babies are delivered when they are dead. Others live a very short time after birth.
Again, that's it. Very great deal of disease that comes from this sort of thing. The health workers from Hope would come here and tell them to boil this water. There are no workers now like that. That's what we want to train. But they would come here and they would live here. And they would tell these people, if they use this water, to boil it. And that would, to be a little dramatic, it would probably save the lives of at least one of these children from dysentery or diarrhea.
They are healthy, but she has not taken them to the clinic.
He's not taking them to the clinic.
He's the one to take care.
They will not.
He's the one to take care.
Oh, he doesn't take care.
Yeah.
All right,
If he's
good.
not sick.
Oh, okay, good. What does he think the husband's job is to his wife? To then take care of him.
No, he's supposed to take care
Okay.
of his wife.
And how does he do that?
Ekyo kikola otya? Oze ekyo kikola otya? Ekyokubalabirira. Encouraging them to dig and to give them food.
To what?
Encouraging them to dig
Yes.
and to give them food.
And to give them food.
Yes.
And a place and shelter.
Yes.
How many children does he have?
Bonna abaana bameka? Abaana bameka? Bonna awamu 6.
6. That's good. Good. It's between 2 wives.
So the Uganda Rural Fund is determined that the very best beginning to a solution to providing the basic human right of medical care to the women of the Chetame area is to purchase a van, a used van actually, that is used by taxis in Masaka, and which is rugged, goes hundreds of thousands of miles, and can take the pounding of the roads of Uganda. They're large and they're spacious, and they will work for carrying people where they need to go, either Chetame or Masaka. In this world, in this Western world, you and I, we don't worry much about transportation, actually. We take for granted that we can get to medical care when we need to, simply. But you know, this isn't true for the women of Uganda or the Chetame village area. They have to struggle with poverty. They have to struggle with disease. They have to struggle with getting what they need in a patriarchal society, which is difficult for them. And they have to struggle with remoteness and distance. You've seen the effect of this. Those of you who want to help should understand that the Uganda Rural Fund is a 501c3. It's fully exempt, and that all the money will go to this specific project. Those who would like to make out a check to help with this project, it can be made out to URF, and it can be mailed to the Uganda Rural Fund in Springfield, Massachusetts. We know that there are many urgent humanitarian needs in this world. We show you this one and ask for your help because it's a specific problem with a specific solution, and that it's within our power to get it to happen, and quickly. We're committed to the purchase of health transportation for these women by the new year. We hope that you'd like to be part of that. But at any rate, thank you so much for your attention, and we hope you're well. Take care.